Senator Coyle. Senator Coyle.
Honorable Senators, I rise today, World AIDS Day, December 1st, 2020, to support Senator Cormier's Motion 44, calling on the Government of Canada to act and meet its 90-90-90 goals. The idea is that by 2020, only 30 more days, 90% of people who are HIV infected will be diagnosed. 90% of infected people will be receiving antiretroviral treatments, and as a result of that treatment, 90% of those people will achieve viral suppression, bringing the amount of the virus in the blood to an undetectable level and thus preventing further spread of the HIV virus. Colleagues, I'm sorry to say that the fast-track targets will not be achieved in most countries. Senator Cormier has spoken at length and in detail about the status of HIV/AIDS in Canada and the need for a strong and funded federal strategy to address HIV/AIDS in Canada. I couldn't agree more with him, and I want to underline his points about protecting our most vulnerable populations who are disproportionately impacted by this long-lasting and catastrophic global pandemic. My intention is to speak briefly in support of this motion, to encourage us to also look at our international commitments and the impact the COVID pandemic is having on the AIDS pandemic worldwide. Colleagues, in the early dark hours of the morning of April 8th, 1982, by the light of a kerosene lantern in the Seventh-day Adventist Hospital in Kanye, Botswana, assisted by very skilled midwives, I gave birth to a beautiful, healthy baby girl, my third daughter, Lindelwa Naledi. Naledi means star, and Lindelwa means the one we were waiting for. At that same time, many other mothers across this sub-Saharan African nation and its surrounding countries were also giving birth to their precious daughters. Little did we or they know what was in store for them and for their health. Our family moved back to Canada when our Lindy was just a babe in arms, and other than the common childhood and adult ailments, Lindy has enjoyed very good health. Those other girls that were born that rare, rainy April night in the desert nation of Botswana, unfortunately fall into one of the world's worst AIDS statistics categories. In 2019, 26.3% of all women between the ages of 15 and 49 in Botswana were infected with HIV. Could you imagine if more than 1/4 of our collective children were infected with HIV? In the year 2000, a 15-year-old in Botswana had more than a 50% chance of dying from an AIDS-related illness. Between 1999 and 2005, Botswana lost close to 17% of its healthcare workforce due to AIDS, 17%. In the UNAIDS report, Prevailing Against Pandemics by Putting People at the Center, released last week, it was reported that 38 million people are currently living with HIV worldwide, with more than 12 million people waiting for life-saving treatment. In 2019, 1.7 million people were newly affected with HIV, and 690,000 people died from AIDS-related illnesses worldwide. In a recent conversation and subsequent correspondence I had with Stephen Lewis, Canada's former ambassador to the UN, former UN Special Envoy on HIV/AIDS in Africa, founder of the Stephen Lewis Foundation and co-founder and co-director of AIDS Free World, Stephen said the following, and I quote, "The consequences of COVID-19 really have to be stressed. It's not just a horrific number of additional deaths through disruption of services. It's also the fact that the world was behind on the 90-90-90 targets even before the virus burst upon the scene. Now it's way behind. Infectious diseases like HIV and TB have become collateral damage in the face of the COVID pandemic. The challenge, as always, will be funding. More and more international finance is going to COVID. The diversion of funds leaves HIV gasping. It's especially hard on community-based services on the ground, end of quote. Investments in HIV and the lessons from how communities have responded to HIV have actually strengthened the fight against COVID. HIV activists and communities have mobilized to defend the gains of the AIDS response, to protect people with HIV and other vulnerable groups, and to push back against the coronavirus. The recent UNAIDS report further suggests that to get the global HIV response back on track, we should adopt a new set of targets for 2025, and that if those are achieved, we will make the Sustainable Development Goal 3.3 of ending the AIDS pandemic by 2030 possible. These targets are holistic and address the inequalities on which HIV, COVID-19, and other pandemics thrive, and put people most at risk and the marginalized at the center. Young women and girls, young women like those born the night our Lindy was born in sub-Saharan Africa, adolescents, sex workers, transgender people, people who inject drugs, and gay men and other men who have sex with men. Colleagues, on November 25th, people around the world marked International Day for the Elimination of Violence Against Women, which launched the 16 Days of Activism Against Gender-Based Violence. There is a significant but not often discussed link between gender-based violence, and in particular sexual violence, and HIV/AIDS. During the 2008 elections in Zimbabwe, countless numbers of women who were associated with the opposition parties were raped by thugs enlisted by then President Robert Mugabe as part of his show of power. We know that sexual violence aids and abets the spread of HIV. During the 1994 Rwandan genocide, the Interahamwe, the Hutu militia group, brutally and intentionally targeted and subjected Tutsi women to sexual violence on a massive scale. A 2001 study revealed that 70% of the rape survivors from that genocide were HIV positive. I visited some of these women as they were trying to rebuild their lives and those of their children in Rwanda. These examples of the weaponization of rape and intentional HIV transmission are very concerning and require particular attention. Now back to Botswana for some hopeful developments after these very painful and horrific examples of HIV transmission. Starting in 2002, Botswana was the first country in Africa to provide free antiretroviral treatment to people with HIV. In sub-Saharan Africa, both Botswana and Eswatini, the former country known as Swaziland, have achieved the 90-90-90 targets, with Botswana currently covering nearly 2/3 of the related expenditures from its own domestic resources. Zimbabwe, Cambodia, Thailand, Switzerland, the Netherlands, Australia, the UK, Denmark are also well on their way or have already met the 90-90-90 targets. Of course, many countries are falling behind. As Senator Cormier mentioned, this, shockingly, includes Canada, where we saw a significant increase in new infections over the last 4 years, for which we have statistics, and that an estimated 14% of individuals living with HIV in Canada are not even aware of their status. Indigenous people account for 9.6% of all people with HIV in Canada, and people in our prisons also have a disproportionately high infection rate. While I'm completely in agreement with and wholeheartedly support Senator Cormier's motion urging the Government of Canada to evaluate the cost of implementing its 5-year action plan on sexually transmitted and blood-borne infections, to establish specific objectives for Canada to achieve in the fight against HIV/AIDS, and to increase funding for the federal initiative to address HIV/AIDS in Canada, I'm asking us to expand our horizons and also remember our commitments to our international neighbors. As Winnie Byanyima, Executive Director of UNAIDS, said in a recent report, and I quote Winnie Byanyima, "No country can defeat the colliding pandemics of HIV and COVID-19 on its own. Such global challenges can only be defeated through global solidarity and shared responsibility." End of quote. When the United Nations General Assembly holds its high-level meeting in June 2021, there will be a golden opportunity for Canada and other member nations to recommit and remobilize towards ending the AIDS pandemic. And a final quote from my recent communications with Stephen Lewis regarding Motion 44, and this is Stephen, I quote, "Yes, the focus of your debate will be on AIDS in Canada. That is understood. But Canada could emerge as an international humanitarian champion if it could take the lead in targeted support for low-income countries struggling with HIV." End of quote. Honorable colleagues, let's show our solidarity with those living with HIV/AIDS in Canada and elsewhere. Let's demonstrate our commitment to those most at risk of contracting HIV everywhere. And let's honor the memory of the 26,000 Canadians who have died of HIV/AIDS, more than half the number of Canadian lives lost in the Second World War. And also let's honor the memory of the 32 million people worldwide who have lost their lives to this viral scourge by passing this motion and committing to do so much more and so much better on this World AIDS Day 2020. Thank you. Merci. Walalio.